ADHD is a common behavioral disorder that affects about 10% of school-age children. Kids with ADHD act without thinking, are hyperactive, and have trouble in focusing.
There are so many children who present with behavior problems, children who present with academic difficulties, kids who are not doing well in school, those who have social difficulties. Sometimes they seem very naughty, out of control, and sometimes they seem as if they're daydreaming. It's important to realize that any percent of them may actually have something called Attention Deficit Hyperactivity Disorder or ADHD.
ADHD is a neuropsychiatric disorder which is very commonly seen usually under the age of 7. But sometimes if the diagnosis is missed, it can be diagnosed in the older children as well.
They may understand what's expected of them but have trouble following through because they can't sit still, pay attention, or focus on details.
As the children, when they grow, they have to have a sound body of mind in order to be successful and productive members in the society. There are many different conditions which can affect them, which can affect their relationship, which can affect their school performance, and which can affect their future achievements. So there is always an effort to look into many different aspects which might be interfering in their development. So one of those is ADHD, which can affect according to the different statistics from 5% to 11% of child or adolescent age group.
Now ADHD is actually a misnomer because about 50 to 60% of ADHD kids may not necessarily be bouncing off the wall. They may not be hyperactive at all, but they may have attention difficulties and they may suffer in their academic achievement. To tell you the truth, the exact incidence of ADHD varies throughout the world. It can be from 7 to 9% maybe in the US, and anywhere from 15 to 25% in the South Asian countries. We don't have our own percentage or prevalence rates in the UAE, but certainly a lot of kids do suffer. Now, is ADHD something we are born with? You know, most psychiatric or neurodevelopmental problems are epigenetic. So though there is a strong genetic component in ADHD, almost 80% of children will have a genetic component. It is interacting with the environment. Hence, in places like Dubai, where there is a lot of change, a lot of stress, changes in language, children are moving from one place to another, they may not have their own families and communities, they may be more prone to ADHD or their symptoms may be more apparent.
The exact cause of ADHD is unknown, but the condition has been shown to run in families, and research has identified a number of possible differences in the brains of people with ADHD compared to those who don't have the condition.
The causes for ADHD is not well established. However, it is known it is genetically transmitted. It is inherited through the parents. If parents have a ADHD, there is a likelihood that the child can have ADHD. The other risk factors are the environments. In the environment, pollution in the environment, stressful environment, or other conditions other medical conditions which can cause or which can contribute into the development of the ADHD.
As I was saying, ADHD has a large genetic component, but apart from that, a lot of environmental factors play a role. There are many children who study in English as a second language. children who study in schools which have different accents, kids who speak differently from their teachers, and so they don't understand what the teacher is saying. And this can give rise to attention problems and ADHD-like behaviors. Similarly, some recent articles talked about how children sleep very late, or they have to wake up very early and travel long hours before they reach their school. Lack of sleep is a very important aspect of ADHD and can give rise to ADHD-like symptoms. There are some research studies which have even talked about food. We know that cow milk allergy can give rise to hyperactivity, fractious behavior, and attention difficulties. Also things like food coloring, junk food. So food can play an important role as well in the symptoms and signs of ADHD. Of course, there are other less common conditions like traumatic brain injury, like meningitis, like birth trauma, like premature birth. These also can add or aggravate symptoms of underlying ADHD.
You might not notice it until a child goes to school. In adults, it may be easier to notice at work or in social situations. It may vary with age.
Another very preventable contributing factor which can aggravate ADHD symptoms is how we handle our children. Harsh punishments, too much work, when the school curriculum is overloaded, when we make children do things which they are not developmentally ready for. Because I know some schools where they force kids to read at a very early age or write at a very early age. All this can contribute and aggravate symptoms of ADHD.
Prevention starts from the early pregnancy even. The pregnant lady should really avoid alcohol, smoking, and if there is any infection or anything, they try to treat it effectively. Because when the mothers are carrying the kids in the womb, these medical problems can affect the child later even after the birth. So prevention starts very early in life. In the children, we will talk more detail at the end, but in the children, giving the clear communication responses, using the reward versus privileges away, taking model, trying to avoid abusing children. These are the few of the things which one must practice in order to avoid the development of more severe symptoms.
Comorbidity in ADHD. What is comorbidity? It is conditions which occur side by side or which happen together. And as I said before, 70% of children with ADHD will have comorbid conditions. One of the commonest comorbid conditions is anxiety. Now, anxiety in children can mean they may not eat well, may not sleep, they may get panicked, they may freeze, they may not like going to school, they may try not to go to school, or they may have stomach aches or headaches or pain in their hands, so any kind of thing to avoid. So depression in children is different from adults. Adults may be crying or withdrawn or like to be by themselves. Of course, adolescent and some children will behave like this, but there are children who will become aggressive. And this is called acting out. So when they are depressed, instead of becoming withdrawn, they act out, they become more disruptive and difficult. They may become aggressive, they may hit out at their playmates or classmates. They may fight with the parents, they may become argumentative. So it's important to realize this so that we know that when a child is depressed, he may act out. The other one is mood disorder, or what we call bipolar. And many of these children can be very aggressive, and their anger and aggression is out of control. So they may break things, they may destroy things, they may become actually very difficult to handle. Of course, we also have something called oppositional defiance disorder, where children are oppositional to any authority. Initially, it starts off at home, so they will oppose everything the parent tells them to do. But later on, even in school, they will defy the teacher. Teacher says, do this. They say, no, I won't. So they oppose the teacher. Sometimes there is passive opposition, so they may not say anything, but they just will not do what is asked of them. And then there is conduct disorder, which is really the dangerous thing, where children become very difficult. They steal, they lie, they vandalize, they may take drugs. So these are the kind of things which we want to avoid. So by diagnosing ADHD early on, we can avoid comorbid conditions, and particularly for them to go down that route when they become diagnosed with conduct disorder.
The ADHD effect on brain has been known through the functional magnetic resonance imaging fMRI, and the children who are having ADHD, it is found that the frontal area is hypofunctioning, while the motor cortex of the brain of the children having ADHD is hyperfunctioning, which can explain the hyperactivity, fidgetiness, and moving around. The other difference is in the dopamine hypothesis, dopamine norepinephrine. Children who are having ADHD, there is a likelihood of decreased dopamine and norepinephrine, which can be replenished with the ADHD medications. There is also FDA approved EEG test, which can show increased theta and beta activities in the children who are having a ADHD.
I'd like to talk about the brain functioning in ADHD. I had a kid who came in last week, and she was very, very anxious because she thought that maybe she's insane or crazy. And unfortunately, ADHD for a long time was under the umbrella of psychiatry. But now even the DSM-5 have shifted it into the neurodevelopment aspect. So it's a neurodevelopmental disorder. Some people walk late, some people are able to organize and function later than others. So do we grow out of ADD? Maybe 20% continue as adults with ADD. Sometimes there's something called residual ADD and adult ADD as well. As I was telling you earlier, it's the executive functions, which is the prefrontal cortex. So organization, deciding, making right decisions. So these kids can be impulsive. They may do something without thinking. They make careless mistakes. They're hasty. They may be not able to focus, so they may have processing problems, so they don't understand things. Their brain is not abnormal. It's just that the neurochemicals are not adequately utilized. Even a hyperactive kid, the brain is actually lazy. What do we mean by lazy? In fact, there is something called the vigilant theory. So the brain requires more energy, so the child becomes hyper to create that energy to keep the brain from sleeping off. So when we look at, if you look at an MRI of the brain, it's all normal. It looks like any other child's brain. But if you look at the metabolic functioning, the glucose utilization, the oxygen utilization, you will see the problems. And the fMRI, the functional MRI, you can see the problems in the circuitry, where the utilization of the neurochemicals is a problem. So it is not that the child's brain is abnormal. In fact, if you talk to some of the gurus of ADHD, we know that way back, our ancestors, there were the two kinds of people, the hunters and the farmers. And the hunters were those who required to be quick, hasty. They had all the ADD-like characteristics. And the farmers were the ones who stayed at home, who grew things. So, evolutionarily, we have different types of personalities. So, ADHD may not necessarily be an abnormality, but it doesn't allow the child to fit into, especially the school situation, where you have to be 45 minutes doing something, the next 45 minutes you have to do the other thing, whether you're interested in it or not. You cannot move, you have to raise your hand, you cannot talk to your neighbor. But as you grow older, not only do our executive functions develop as we mature, but also we go into vocations or jobs which we are interested in. And we know that interest can increase our focus. Also, if I'm an adult and if I get tired, I can just get up from my chair and walk around in the office. Nobody's going to say anything to me. Whilst in the classroom, they get scolded. So it's also the situation which makes a difference. But again, I don't want to make ADHD something small. It is complex, and it can affect kids in a big way, not just behaviorally, but socially and cognitively. Because sometimes they may not be able to remember very well, or especially boring stuff, or they may not be able to organize their writing very well, they may not write very neatly. So they may not be able to do research in a very analytical way because they are disorganized and impulsive. So it is a disorder, it is complex, but it has a lot of people who are extremely bright, very creative, and we need to pick up these kids and help them to think out of the box and not just label them and drop them.
Always be on the lookout for positive behaviors. Ask the teacher to offer praise when your child stays seated, doesn't call out, or waits his or her turn.
Understanding the complexity of ADHD both by parents, teachers, and professionals is very important. It is not a checklist disorder.